everyone, it's me again. So yeah, today we're going to talk about birth control. I think this is a topic that involves everyone. Everybody needs to know about birth control at some point of your life. At certain point of your life, you will need to be on some form of birth control. So today I'm going to talk on this topic that affects everybody. I guess there's a lot of rumors everywhere. There's a lot of myths everywhere. A lot of people are very scared to embark into a birth control plan because they tend to listen to what the mom has to say, friends have to say, relatives have to say, and many people actually listen to a lot of negative stories and then very afraid to embark on birth control. And it's quite a problem, especially recently. I see many during MCO. MCO is a period of baby boom. That's what all the doctors expected, and it's kind of true. I see so many new pregnancies. Of course, to some it's the good news because they plan for it, and some is even better because they have planned for years and years, and then suddenly they just conceive during MCO because that is the best time to get pregnant, the easiest time to get pregnant. A lot of people are now having more time at home, more time to spend with your husband and wives, building better relationships during this time, and as a result they get pregnant. But we also see a lot of unplanned pregnancies. Unplanned. Let me quote you one example. I have one lady who came to me, you know what? It's a 6th pregnancy, 6. And she just told me she cannot. But she has been seeing me for many pregnancies already. And every time after she gives birth, she'll tell me this is the last. And she will tell me that, but she's always so scared. It's like when you tell her this is the best, and then she'll go back and investigate and study, and then she's not there to do it again. She's not there to choose any form of birth control, and then here she is again pregnant for the 6th time. Well, we do not want that to happen. Why? Because we believe that every pregnancy should be planned, because that is the only way you can give the best to your baby. Because when you're planned, both physically, mentally, everything, financially, socially, everything well planned, your whole pregnancy will be stress-free. Childbirth and care of the baby will be stress-free for both you and your husband. And that is why birth control is very important, and this topic is very important for everyone. Whether you're married, you're not married, it's always good to know. It's always good to know, because even if you're not married, you're single, you won't know what's going to happen tomorrow. You may find new love tomorrow, and you may need to think about contraception as well. So today I'm going to talk about birth control, all the forms of birth control available. Okay, contraception in general, I always divide to 2 groups. 2 groups mainly. One is male and female. The 2 groups, male and female. So when it comes to male, I want to talk about male first because it's a lot simpler. Male is a lot simpler. It's either you use condom, or you we call coitus interruptus, which means you ejaculate outside, or you go for permanent, which is vasectomy. So for men, there's only 3 options. It's something permanent called vasectomy. And then you have things like condom and coitus interruptus. Of these 3, I'm going to put vasectomy last together with permanent ligation of women because those are permanent contraception. Let's talk about condom. A lot of people use condom. Trust me, condom is good. I strongly feel that condom is good, but it has only one problem. Why I love condoms is because it prevents infection. Women should ask men and insist men use condom is because we want to protect ourselves from infection, and many of these infections that men transmit to women actually cause a lot of illnesses to women as well. So it's very important to use condom. Condom is very important, but there's one problem. Condom is not 100%. Okay, for all of you users of condoms, ask yourself, do you have a certain point where condom is not available and you just cannot tahan and you just have to do it and you pray hard that you're not pregnant? That is one big mistake that many people do. And then they got pregnant. Because I see couples coming into my room, and then when they confirm pregnancy, and then they just turn to their husband and they were like, "There, I told you so. You know, you see, you see." So, and then the husband just keep quiet. And we know exactly what happened. Somebody must have forgotten to use the condom. Or somebody must have forgotten to bring the condom. So, number one, condom is not reliable because it depends on somebody to wear it. And what if it's not available at that time and you die must do it? How? And not only that, sometimes you thought there are many different people practice different things with condoms. Some people, they will go in first without condom. They thought that, no, that's not going to be it. Just play first, okay? Play first. Then they come out, then they put on their condom, then they go in the second round, and that was a serious one. But do you know your play also sometimes you cannot control, maybe accidentally come out a little bit. That can make you pregnant too. Okay? So, and not to mention, condom can also get torn. There are people condom torn. So condom torn, you get pregnant. So how? And have you ever visited a condom factory? Do you know they have quality control, right? All factories in this world have quality control. So when you go to a condom factory, do you know what's going to happen? I've been there, a Malaysian one. They will actually have every carton, they will pick out like 10 and blow it, blow it like a balloon and see whether there's any leak. If that 10, there's a leak, then the whole carton, they put aside. They are not going to sell it. But if that 10 has no leak, then the whole carton will be sold. I was like thinking, oh my God, what if they pick the wrong 10? Okay, so we also know condom can have leak, condom can tear, and there will be moments that we forgot to use a condom or we couldn't control ourselves and we have ejaculated before the condom is placed on. So because of that, condom doesn't have a high percentage of contraceptive protection. It only gives about 85 to 60%. Okay, it only gives about 85 to 86%. That's it. Less than 90% safe. So I always like to tease women. I say, you use condom 5 to 10 years you pregnant once. 5 to 10 years, you're not going to pregnant every year. You're pregnant every 5 to 10 years if you use condom. So coitus interruptus, oh my God, that's even worse. You are totally depending on a man to decide whether he ejaculates inside you. Oh my God, don't do that. It's not something you can control, and it's not something he can control at times. And if he accidentally ejaculates, what is he going to do? Say sorry? But who's going to get pregnant? You. So never depend on men for this type of contraception. No, definitely not safe. So there's another problem with coitus interruptus because they only pull it out at the very last minute. But sometimes when they pull it out, they can be half a second too late. Half a second too late. And you have that little bit that's in. That's it. Enough to make you pregnant. So in general, male contraception is not effective. Male contraception is not safe. I will never rely on a man to decide whether I get pregnant. When you get pregnant at the end, you start scolding him. What's the point? What's the point? We as women need to take charge of contraception. Number one, we could actually, I always advise women to actually have condoms themselves. Don't depend on your husband to buy condom. Because when you depend on husband to buy condom can go out of stock, So no, you have to, if you decide to use condom, you need to be the one in charge of the condom. Because when pregnant, you are the one pregnant. If your husband says that or your boyfriend says that we cannot keep the baby, you have to go through the abortion. If your boyfriend says, I don't want this baby, you have to be the single mom. Your husband say anything also, you are the one who goes through. Even if your husband say, it's okay, let's give birth, you are the one who's going to give birth. Are you willing to go through that? So that's why you need to be in charge of contraception. Birth control should always be in women's charge, never men. Never men, okay? Remember that. So let's talk about women contraception. So if you're going to use condom, then my first advice for you is you are in charge of the condom, not your boyfriend or your husband, okay? Okay, now we could talk about women. Women, I like to divide into 3 groups. Number 1 is permanent, which I mentioned earlier. Men got vasectomy, women got tubal ligation. So this is permanent. Number 2, non-permanent but regular use. And the third one is emergency contraception. So what is emergency contraception? It's things when emergency law. Let's say you have been single for all your life and you didn't see it coming, and suddenly it just happened. You know, you have a boyfriend and suddenly it just happened, and then, oh gosh, how? Then there's such a thing called emergency contraception. Emergency contraception, there are 2 types. One is we call morning after pill. Morning after pill, which means I take it the next morning. I made a mistake tonight. Tomorrow morning, I'll go to the pharmacy or I go to the GP and I'll say I need an emergency contraception. I need the morning after pill. Take that pill and that's it. Okay, is it safe? Well, better than nothing, but the protection rate is only about 95%. So you still have 5% chance of getting pregnant. And the only problem with this medicine is your period will be abnormal. So it's going to be so stressful when your period don't come, and you're going to worry that you're pregnant, but it could be due to the medicine. Or your period come at the wrong time. You thought your period come already, but actually you may be pregnant. So when you take emergency contraception, you have to be prepared that your period may come or may not come. Doesn't mean you're pregnant or not. You still need to do a pregnancy check. That is if you do take a morning after pill. Then there's a second form of emergency contraception. Okay, morning after pill is for the morning after. Yeah, the longer you wait, like you wait for 2 mornings, 3 mornings, then your success rate gets lower and lower and lower. Your protection gets lower and lower. So theoretically, it should be the next day. But let's say you missed it, you know, for some reason the next morning you have no time to go and find pharmacy, you're busy working, you couldn't buy it. There's another emergency contraception can take within the first 5 days. Within the first 5 days from the point of intercourse. And that is to put an IUD inside your uterus. So you have no contraception before, you're single all along, something happened, you didn't see it coming, you ended up having sex, and you cannot afford to get pregnant. You can always come to a gynae to get an IUD in. IUD within the first 5 days, also a form of emergency contraception. Again, it's not 100% protective. The protection is again not very high, about 95, 96%. Well, better than nothing. So even if you forget your morning after pill, remember you can still put in a IUD. Okay? Okay. Then next will be things that you take regularly. Okay, bear in mind, emergency contraception is for emergency. Okay, I know a lot of married couples who are just doing emergency contraception. That doesn't work. I guarantee you pregnancy. Because it's only 95%. If you use that as a permanent thing, I guarantee you a pregnancy. So that should not be the way. Sometimes some people use it with condom. Like they always use condom. And then one day the husband forgot to use the condom. Then they go and buy emergency contraception. Yes, that's possible. But again, they are not really secure. Okay? So I want to re-emphasize there's a reason why it's called emergency contraception, because it's for emergency. It's not for somebody who is married or have regular intercourse with a permanent partner. So if you are married and having permanent regular intercourse with a permanent partner, you need to think about something more regular. So regular, you have many types. You really have many types. Trust me, you have many types. So choose what you think is best for you. You can have pill, you can have patch, you can have 3 monthly injection, you can have an implant below at your arm. Every 3 years you change. You can put an IUD, and you can also put Mirena. Okay, these are the common things in Malaysia. There may be other things that are available over the West, but in Malaysia, these are the common ones, easily available. So you can have tablet, the pill that you take every day. You can have patch, which is a plaster that you stick onto your tummy and you just change it once a week. And you can have 3 monthly injection, 3 yearly implant, IUD or Mirena that usually can last 5 years. Okay, so there are few ways to help you to think. Some people don't like hormone. They have misconception. They listen about all kinds of bad things about hormones. Okay, if you don't want hormone, well and fine. There's only one option, which is an IUD. But IUD is 98% effective. Because it doesn't have hormones, so it is also not so effective. So it's 98%. So it's not 100% lah. That's why on and off you still hear people getting pregnant, right? But it can be 100% if you combine it with something else. Let's say I use IUD, but I still use condom. Then 100% no. You ask me, for couples who don't want to get pregnant, always use 2. 2 is my advice. Don't just rely on one. Put an IUD, no hormone. Use condom, also no hormone. Both use, yeah? Because both also not 100%. But both together, then you can be very sure it's 100%. So, if you do not want any hormones, that is the best combination. And it's very good. Because IUD, what are the side effects? Infection, heavy menses. So heavy menses is something you need to learn to live with it if you choose IUD. Infection is something that comes with IUD. Condom prevent infection. So you see, perfect. You use condom, you put IUD. Combine, 100% safe. Okay? So that is one combination that you can think of if you choose non-hormone. If you don't want hormone, you don't like hormone, you can always do that. So the IUD, the only advantage is it has no hormone, so it's not going to disturb your period. Your period will be as usual, except in IUD, period is heavier and longer. So your period flow will be heavier and more days now, but the timing of when the period will come will not change because there's no hormone. But the only disadvantage will be the risk of infection, as well as it's only the heavy menses and the risk of infection. And yes, not to forget, it is only 97 to 98% effective. But IUD can also be used as emergency contraception, which is about 95 to 96% effective. So that's IUD if you don't want hormone. Then let's say you want hormone. You want something more secure. You don't want IUD because let's say you know IUD is not so secure and your husband is not willing to use condom. Then you don't feel so secure with just an IUD. Then it's time to use hormonal contraception, because hormonal contraception is more effective. And hormonal contraceptions, again, I divide into 2 groups. One that gives you period every month on the dot, and the other one that disturbs your period. Some people like periods that come every month on the dot. Some people prefer the period not to come, because most of the contraception that disturb your period, the period tend not to come. So in Malaysia, generally I notice, if you're talking about Chinese, they love the period to come regularly every month. But if you talk about Malays, they prefer period don't come. That's why the options of preferences in contraception differ even among the races in the country. Chinese tend to look for IUDs as well as oral contraceptive pill and patch. Malays tend to go for implant, 3 monthly injection, and Indians tend to go for IUD or vasectomy, actually Indians as well. Very interesting to some people that in Malaysia there is this racial preference. But let's talk about it all together. I'm going to explain each and every one. Okay, if you want your period to come regularly, you only got pill, the pill that you take every day. The pill that you take every day, we call it oral contraceptive pill, gives you regular period. especially the normal ones. There is a type of birth control pill that you take every day that we keep for breastfeeding mothers, but that one the period doesn't come or very irregular. But the normal one we call the combined oral contraceptive pill, which is COCP. C, combined, O, oral, CP, contraceptive pill. COCP gives you a regular menses, it regulates your menses. Even your menses not regular will be regular because of COCP. And it will come every month on the dot. So that's one. Patch is another one. Patch is a patch that you put on your body. It's like a plaster you stick onto your body and you just change it every week. It's very convenient. A lot of people like it. And same, your period is very regular. So both of these are the same. More or less the same. One is you swallow in and one you stick on, but equally effective. We say 99.5% effective. 99.5% effective. Patch is slightly better than pills because we don't need to worry about you forgetting your patch, because the patch is on you all the time. It's less likely to forget compared to the pill. And the pill, we sometimes worry if you take with other medicine, then it's not so effective. So, but both of these give you very regular period. But when it comes to all these pills, a lot of people only worry one thing. They worry they put on weight. All hormones they worry put on weight. But trust me, pills have evolved through the years. From high dose to low dose. If you're worried about the weight gain, take low dose. Don't buy high dose. Don't buy the cheaper versions, which are the older versions. Buy the more expensive ones that are low dose. And another thing, most of the low dose actually don't make you put on. But there's one problem with hormones, which I have to admit, they tend to make you feel hungry all the time. So it increases your appetite. So I always tell women who succumb to appetite, that means if you're hungry, you must eat. Then hormones may not be suitable for you because it makes you eat. But for women who are always watching their diet, no problem with hormones because you're always watching your diet anyway. So that is the main disadvantage. Other than that, periods very regular. Small group of people cannot take oral contraceptive or even the patch because they have a certain reaction to hormones. The reaction that people cannot accept will be giddiness and vomiting. They feel like as though you're pregnant again. So if you have that, then don't take oral contraceptive pill. And sometimes to some people, even 99.5% protection may not be in fact enough for certain women who are very easy to get pregnant. You know, there are some women just super easy to get pregnant. Every pregnancy, they plan it this month, they get pregnant this month. This group of women is better you combine both oral contraceptive pill or patch if you choose it with condom. Always have two. If you want 100%, always use two. And condom protects you from infection as well. So it serves two purposes. Okay? Then, other than these two, that I'm going to talk about implant as well as the Depo. Depo-Provera is an injection you inject in your bum every 3 months. And implant is the implant you put here every 3 years. These two, both the period will be very disturbed. But it is something that you don't need to think so much. But although it's disturbed, it tends not to come after some time. Initially, very disturbing, keep coming. Nobody likes the initial part. The menses is very annoying, but after some time, it tends not to come. So for women who prefer no menses, they sometimes actually like Implanon and Depo. That's why I notice a lot of Malays like Implanon and Depo. Even the Indons, many of our Indonesian workers in our country have an implant inside them. So implant and Depo, the main thing is your period is irregular. Weight gain is something again related to Depo can have some weight retention, water retention that cause weight gain. Not so much with Implanon, but again it will increase your appetite, so you want to eat, then you put on weight lah. Okay, but especially Implanon, the effectiveness is 99.9%. 99.9%. And it doesn't depend on you at all because it's there for 3 years. If you take pills, you take patch, you go for depot, you still have to remember to do it. Pill have to remember every day. Patch have to remember once a week. Depot have to remember 3 months once. So if you do want to think about your depending on you afterwards, forget, then implant 3 years, 3 years, and the protection is 99.9. Okay, then we go to IUD and Mirena. IUD and Mirena both put in the uterus, both can last 5 years. I mentioned about IUD just now. It is only about 97 to 98% protective, but the only side effects with IUD would be infection and heavier period and longer period. Then now we talk about Mirena. Mirena also put inside the uterus. It can last 5 years. Only thing, Mirena now, you won't have more infection, but you also have less period. So it's the opposite of IUD. Some people, when they tell me that's it, I do not want any babies anymore, then I say if you don't want babies anymore and you want something convenient, then I will say you choose either a Mirena or IUD lor, because both over 5 years is very convenient. Every 5 years your last baby born, you fix an IUD or you fix a Mirena. Every 5 years you go and change. So your baby 5 years old, you go and see gynae. Baby 10 years old, you go and see gynae. Baby 15 years old, you go and see gynae. It's so simple to remember, right? So, but Mirena is a lot safer because it combines an IUD plus hormone. So as a result, it's very much more effective. The effectiveness is again 99.9, so it's very, very secure. Okay, if 99.9 is not enough for you, then just add a condom, okay? It's very secure and it reduces the menses. It's not so irregular as implant and depot. It tends to be quite regular, may run a bit, a few days maybe, but it's quite regular and it is 99.9% effective. So these are the contraceptions for, I would say, the long-term contraceptions. And last of all, I want to talk about permanent. Permanent, you have vasectomy and tubal ligation. Tubal ligation is a surgery. If you happen to do a Caesar, I always say if you're going to do a Caesar, then you think this is going to be last baby, might as well just do a tubal ligation because it's convenient and you don't need to think about it anymore. But if let's say you're going to have natural birth, I normally don't encourage a tubal ligation because you're going to purposely go for a surgery just for contraception. But sometimes to certain people, it may still be necessary, not a problem. Okay, both vasectomy and tubal ligation, when you think about doing it, I have only one advice. If you walk this path, please make sure you don't regret. And everyone, the immediate reaction, they will tell me, no, I won't regret. 3 is enough. 4 is enough. Yes, you won't regret. But trust me, we as gynaes have seen people regretting. And when do they usually regret? They usually regret when they find a new partner lor. They want to remarry lor. You know, everybody thinks that our life is like a fairy tale, you know, everything is going to be smooth sailing. But it may not be. You may need to remarry. And when you remarry, you need to give birth again. And so you don't make these type of decisions that has no point of return. Women, tubal ligation, still not too bad. You can always still go for test tube baby, IVF. But men, when you do a vasectomy, it's forever. Because vasectomy, after a couple of years, men do not produce sperms anymore for the rest of your life. So if you are going to do a vasectomy, it has to be permanent. If your wife one day runs away with the children, you have no other children, you want to remarry, you cannot have children anymore. So this is something you need to think carefully. Generally, I don't encourage permanent contraception in most people. Maybe in a small percentage of people, but most people, I feel that you shouldn't go for permanent. But in case you need to, are there any side effects? Tubal ligation, a lot of people say will disturb your hormone. No lah, tubal ligation does not disturb your hormone at all. The only one reason why the hormone is disturbed, the story comes this way. Long ago in the past, tubal ligation is a very famous mode of birth control in the past. More of our mother's generation. Those days they used to have so many children, you know, 5, 6, 7, 8. They don't know how to stop, right? Then the doctor say, you have to stop, you have to stop. Then they will make them do the ligation, and guess what happened? They usually do it like in their 40s. And then after the ligation, their periods start to become abnormal. They blame the ligation. Che, not the ligation. You are already how old? 40 something, sure. The period will be irregular. That's how the whole story starts. Tubal ligation does not affect your period, does not affect your hormones at all. Tubal ligation, the only side effect we can think about is pain. Because of ligating the tube, sometimes it can cause pain, and this pain can be long-term for the rest of your life. If you're lucky, it's just a little bit of pain. Not so lucky, the pain may be more. But not everybody will have pain lah. Not say I say pain then you think sure pain. No, some people only. But is it really safe, tubal ligation? Again, 99.9%. Okay? So, tubal ligation, Mirena, and implanon are equally safe. So because it's equally safe, why you need to choose something permanent? Might as well choose something not so permanent. Another advantage of choosing things that are not permanent is that you can choose and change. Like I put an IUD, then the period become heavy, or you got a lot of infection, then I can take it out, and then I can go choose something else. I can take the pill, you know. But if you do a tubal ligation, and if you have a lot of pain, there's nothing we can do already. There's nothing any doctors can do. You have to learn to live with the pain. Vasectomy doesn't have any side effects to men, and because it's a very simple procedure, we tend to say vasectomy is better than tubal ligation. But my same advice to most men, and I also know a lot of urologists who refuse to do vasectomy for the same reason, is that men need to make sure that men can still father a child, because that is your security, you know. Because women can leave you with all the children one day and you'll be alone, you find a new wife, you need to have children again, right? So it's best that you do not do a vasectomy as well. So of all the contraceptives I mentioned so many contraceptions so far. So I hope you understand, but this is the general rule. Emergency contraceptions are only for emergency, not for permanent relationships. And among the other long-term contraception, it's best not to choose something permanent in case you will regret one day. Okay, so that's all I have to say about contraceptions. So now I'm going to see if you have any questions you want to ask. I did see some questions that pop up, and as usual, as I mentioned earlier, if you can choose 2 types of contraception, that will be even better. That will be the best way to keep it 100%, okay? You can combine any 2 that I mentioned earlier, and that would be 100%, because so far nothing is 100%. Nothing is 100%. Except, of course, if you remove your uterus, then it's 100%. How long does Depo last? Depo is only for 3 months. 3 monthly injection. Depo is the 3 monthly injection. The older type we use Depo no etestosterone, that one is 2 monthly, but the newer one we tend to use Depo Provera, which is 3 monthly. But Depo actually is not for it's not, you can use one for years, but we do not encourage if it's for a long time. That means not for 10 years, 20 years, because Depo is the only one that has a bit of issues. Okay, Depo we cannot use until forever because it causes osteoporosis, but implanon can, IUD can, Mirena also can. Patch and OCP, once you have hypertension and diabetes, then you need to stop, okay? Sarah asks, can the patch have any side effect like skin sensitivity? Yes, of course. That is why usually we ask you to put the patch at different place every time. But not everybody will have. It's supposed to be less allergenic, so not many people actually develop sensitivity. In fact, I don't see many develop sensitivity, but there are. I have to admit there are. Okay, if used properly, that means don't always stick back the same place. Okay, that's the key. Don't. You have to keep changing the place you stick so that you have less chances of actually develop allergy. How do you get this patch? You can get it anywhere in the pharmacy. How advanced must use before it takes effect? It takes effect the moment you start using it, but you need to use it correctly. So it doesn't matter whether oral contraceptive pill or a patch. The first time is best to get it from a gynae, so that we explain to you how to use it first, and we make sure it's suitable for you. Then the rest you can just buy it from pharmacy, of course. And usually pharmacy also will make sure you have used it before they sell it to you, okay? Is implant painful? In a way, yes, because we are going to put something inside. So it's a procedure, it's a minor procedure that we have to put something inside. And you will have a wound there that will take about a week to heal. And every 3 years, we have to make another hole to take out the implant and put back the implant, put a new one. So it is going to be a minor surgical procedure each time. If it's painful, yes, the pain is only when we give you the local anesthetic. When we give you local anesthetic, it will be painful. But after that, when we actually make the hole, you don't feel anything lah. Hurts like as though sore, like as though you have a blue black at your arm for the first 1 week, and then that's it lah. Not really that painful, but you need to be very brave to actually face the procedure, because you'll be seeing something being done just next to your eyes, and you'll be looking at it, and you need to be kind of brave to actually do it. But it is effective, 99.9. Yes, Mirena, does it have to be done during my menstrual cycle? And actually, everything also we do during menstrual cycle, whether IUD, Mirena or implant. Not reason is because we want to be 101% sure that you're not pregnant before we put it in. That's the main reason. But for Mirena and IUD, we prefer during menses is because the passage is open. We're going to stick something into your uterus, right? So we want to make sure that the uterus is opened up nicely for us to stick the thing in. So that's why we want to make sure during period, because period, usually the passage is a lot softer and wider and easier to go in, mainly for that. But there are people who come to us during non-period and they are very sure they are not pregnant. And they are very busy people. They can never come during menses. I am one. I use a Mirena myself. And I also make sure my husband uses condom. So it's 101% I will never get pregnant. But I can never make sure that I go and fit my Mirena on my period, because I'm always busy. So I just go there and get it done with. But if you do it any other time other than during period, you must be sure that you're not pregnant, number one. Number two, you have to be able to face the pain, that it will be slightly more painful lah, but bearable lah. I've done this so many times, never during period anyway. Annie asks, is this real? If you're not suitable using Depo, means you're not using. Yes, because it is the same route of medicine, because both of them contains progesterone only. So if you are not suitable for progesterone, both of them will be more or less the same. Not 100%, but more or less. We need to know why you're not suitable. You're not suitable because of your menses. Then I don't think so, because they're both different hormones. You're not suitable because of side effects like headache, giddiness, vomiting. Then it won't work lah. Everything will give you the same headache, giddiness, okay? Yong Kwan asks whether you need to do pap smear every year. Okay, I think I've answered this question before earlier in my other talks. Number one is like that. Pap smear is a test that we know that the more frequent you use it, the more frequent you do it, the more accurate it is. Pap smear is not 100% accurate. It's like today you may have some problem with your cervix, you may have HPV infection already, but then if I do a pap smear, I may miss it because it's not 100% accurate. So let's say if I do it every day, if I do it every month, keep doing it. Of course, if I have HPV, if I keep doing it, most of the time I'm going to get a abnormal result, but occasionally I will still get a normal result. So you see, no test in this world is 100% accurate, especially when it comes to tests like pap smear. Just like now our COVID-19 test, we also know it's not 100% accurate. So how? Keep doing it, then it's all 100% no? So pap smear is also the same. But there is a lot of confusion whether you should do it every year or 3 yearly. You must understand there's such a thing called government screening program. Government screening program. All screening programs run by governments, they need to think about money. If I'm going to do pap smear on a woman every year, I know if I do on a woman every year, I will be able to detect 100%. I can prevent cervical cancer 100%. But I need to spend so much money to do pap smear on every woman in the country every year, right? Then After that, you need all these things. Research are all well done one in the West, and pap smear is quite a famous screening program in certain countries in the West. Every woman gets a pap smear done, but in national screening program, they always screen only 3 years once. Why 3 years? It's because of money. If I do every 3 years, I will still have 1 to 2% of women with cervical cancer. Can I live with 1 to 2% of women with cervical cancer? How much do I need to spend if I need to treat these cancer patients? This 1 to 2% of women getting cancer I need to treat them, right? So I also need to spend money. So they weigh it. Doing pap smear to all the women in the country every year, how much I need to spend over 10 years, 20 years, 30 years. I do it 3 years once, and 1% of these women are going to get cancer, and I'm going to treat them. How much I need to spend over the next 10 years, 20 years, 30 years. And so, government screening programs have decided that 3-yearly pap smear is the best because it saves them the most money. So, I will allow that 1 to 2% of women to get cervical cancer is fine. I just need to treat these people. That is government. But in Malaysia, most women are getting their pap smears done in the private. So if you're going to do your pap smear in the private, and pap smear honestly is not that expensive, why wait for 3 years and give yourself that 1% to 2% chance of getting cervical cancer when you could do it every year? But you must understand that most of the time when you do a pap smear test in private, you don't just do pap smear. When you go government, you do a pap smear, that's all you get, pap smear. When you see a private doctor for pap smear, you get an ultrasound done, you get a breast checkup, you get breast ultrasound, you get mammogram. And you must understand, breast checkup is not 3 years once. And as a result of that, you're doing a lot of things together, and that is why we generally say that all women should see a gynae once a year for your pap smear, ultrasound, and breast examination, as well as breast ultrasound or mammogram. So yes, do it every year. Sarah asks, do the contraception options differ depending on someone's health status? Yes, when you have hypertension and diabetes, normally we will say it's best not to go on things like oral contraceptive pill or patch. The rest is still fine. This is Sarah Siguti. She asked, what about people saying that after some form of contraceptive or pills long term, it will make you hard to conceive when you go off it? Because you know it's not true. What happens is it's simple. Okay, especially in the past, not so much nowadays, but in the past. In fact, nowadays I always feel it's the other way around. It's the opposite that will happen. Okay, women in the past, they marry very young. They get give birth, and what happens in most contraception in the past, they make you put on weight. And generally we know one thing, women who are overweight, more difficult to get pregnant. So if you put on weight, then your chances of getting pregnant will come down. So it's not the medicine directly, it's not the contraceptive pill directly, it's because of the weight you put on. But women today is the other way around. So, but I never directly mentioned in my other videos, but generally we know that contraception, especially hormonal contraception, protect women from contraceptive endometriosis, protect women from fibroids, endometriosis, endometrial polyp, prevents endometrial hyperplasia, prevents uterus cancer, prevents ovarian cancer, and as a result, because your uterus is healthier, women who are on hormonal contraception actually protecting their uterus when it comes to fertility. Okay, to be very telling you the real truth, a lot of women today, because they married late, they find it very hard to get pregnant. That's because their uterus is no longer healthy the day they got married. Had they been on, let's say, oral contraceptive pills since their 20s all the way until their 30s, until the day they decided to get married and get pregnant, it will be a lot easier to get pregnant if they have been on hormonal contraception. And that is the truth. But unfortunately, people don't believe in truth. People believe in what they believe, in what they listen, which are no longer true. Because those things are for women in the past. That's why I know why it comes about. But it's for women in the past. Afida asked, tried IUCD last year but got continuous bleeding and spotting for 4 months. My gynae gave me Noculot and it stopped for 1 week. It stopped my breast milk also, then it started bleeding again. After a few visits, I got prescribed tranexamic acid to stop the bleeding and it stopped for 4-5 days and it started again. And I decided to take it out after 4 months. Okay, Afida, I think there's something wrong with your uterus. IUCD doesn't give this problem unless you have an underlying infection or underlying polyp that nobody realizes. And it's very common for people to not realize it and just put in an IUD. So there's something wrong with your uterus that you need to sort out. Maybe an infection, or could be due to polyps. Actually, a lot of times it's infection because of the IUD. When you put in, the IUD can bring all the bacteria from exterior down into your uterus and it can cause all this bleeding. And that's why when you take it off, it settles. Okay, so most likely it's either an infection or some form of polyp. If you need to get an appointment with me, you can WhatsApp to 012-322-9820. Okay, breastfeeding. Suling Tan asks, can you use patch during breastfeeding? Oh no. Breastfeeding, if you are breastfeeding, you can only use IUD, you can use Mirena, you can use Depo, you can use Implanon, you can also use contraceptive pill, but the ones for breastfeeding, which we call progesterone only pill, okay? So you cannot use patch or the COCP, cannot. Rachel Poe asks, is it very important to get our Mirena checked every year? I think it's part and parcel of your gynae check. So it's not because of your Mirena, but all women need to see gynae every year for their ultrasound, their pap smear, and their breast examination, okay? So because of that, then you better, when you go, you just a one-stop, you do everything. One of the reasons why we want to do pap smear for people with IUCD and also Mirena, because of sometimes some infection can cause the infection of the IUD, and it can be detected through a pap smear. So it's always good to have the pap smear checkup and your Mirena checkup every year. All right. Okay, that's all the questions you have, and thanks for joining me again in this live video, and Selamat Hari Raya to all the Malays and Muslims out there. Let's hope that this pandemic is the last one we need to go through. Let's hope that next year Hari Raya will be back as usual with all our extended families back in our kampong. I'm sure we missed the kampong so much. And yeah, stay tuned for my live video again next week. Same day, same time, yeah? Sunday, 9 p.m. Bye-bye.